Welcome back, everyone. Today on our Explainer, we're looking past the shiny hospital lobbies, the super friendly bedside manner, and those high-tech marketing campaigns. If you're the kind of person who likes to get straight to the facts, you know that the true story of a healthcare facility isn't actually found in a glossy brochure. It's found in the data. So today, we're going to unpack the invisible metrics, the hidden scoreboard, if you will, that holds healthcare facilities accountable to patients, regulators, and investors alike.
It brings up a really massive question. How do we actually measure the quality of a hospital? When you or a loved one are admitted, you're trusting that the facility is safe. But, trust isn't a metric. To truly understand a hospital's performance, we have to dig into the actual clinical data that they are required to track and report. Essentially, we have to look really closely at the times when things go wrong.
Okay, let's dive into this. Here's our roadmap for today. First, the hidden hospital scoreboard. 2, serious reportable events. 3, hospital-acquired conditions. 4, tracking unplanned readmissions. And finally, number 5, why these metrics matter.
All right, kicking things off with Section 1, the hidden hospital scoreboard. Before we can even begin to analyze the data, we kind of need to know who is setting the rules for how this info is collected and reported in the first place, right? This brings us to the SASB standards. Think of this as the ultimate standardized scorecard. The Sustainability Accounting Standards Board framework requires healthcare delivery entities to systematically report on quality care and patient satisfaction. This isn't just about good PR. This is a highly rigorous standard used to gauge actual performance and financial risks. By standardizing these metrics, we get a concrete apples-to-apples comparison of exactly how different facilities manage the immense responsibility of patient care.
Moving right along to Section 2, serious reportable events.
We are talking about the absolute most severe category of hospital errors here. A serious reportable event is an incident that is serious, of deep concern to the public, and, I really want you to hear this phrase, largely preventable. These aren't inevitable complications of a really tough disease. These are system failures. The stakes around tracking these events are absolutely critical because in a perfect world, the number of these events should literally be 0.
And this brilliantly, or maybe chillingly, illustrates the sheer scope of what facilities are legally bound to track. Hospitals must report on surgical events, product and device malfunctions, patient protection failures, care management errors, environmental hazards, radiologic incidents, and even potentially criminal events occurring right there within their walls. Every single one of these categories represents a profound breakdown in the safety net.
To really grasp the human element here, let's break down that dense terminology and contextualize it with some specific severe examples pulled directly from the source standards. A surgical event means a total nightmare scenario, like leaving a foreign object, say a sponge or an instrument, inside a patient, or actually operating on the wrong body part. A radiologic event could mean accidentally introducing a metallic object into a highly magnetized MRI area, which can cause lethal projectiles. An environmental event includes patient injuries from electric shocks, burns, or unbelievably being hooked up to the wrong gas instead of oxygen. These are the terrifying, largely preventable errors that make up our first major metric.
Okay, on to Section 3, hospital-acquired conditions. So, shifting our focus away from sudden dramatic events, it's a bit of a tough reality to face, but sometimes the treatment environment itself presents entirely new risks to patient safety. I mean, you go to the hospital to get better, but simply being inside those hospital walls exposes you to specific hazards that you just wouldn't face sitting at home. Tracking these is our second major pillar.
Let's do a quick plain English translation of some of these clinical conditions to make sure we all understand exactly what is being measured here. When you see a hospital reporting its rate of iatrogenic pneumothorax, what they're actually talking about is a collapsed lung that was caused by a medical treatment. Unrecognized accidental puncture means a surgeon accidentally made a cut or hole in the abdomen or pelvis and didn't even realize it immediately. And a perioperative pulmonary embolism is a highly dangerous blood clot in the lung that develops right around the time of a surgery. Other common conditions you'd see in this category include severe bed sores or infections introduced by catheters.
Now, what's really interesting about this is how all those terrifying medical terms get transformed into structured, reportable data. There's a standardized reporting grid outlined by SASB that tracks these condition incidence rates across different facilities. Basically, you've got the specific conditions, infections, pressure ulcers, falls with hip fractures on one axis, and on the other, you have the incidence rates per hospital for Facility A, Facility B, Facility C, and so on. It completely strips away the emotion and provides a cold, hard comparison of where you are most likely to pick up a secondary illness or injury. But how exactly do they calculate the numbers for that grid?
Well, it's a very specific, logical flow that transforms isolated clinical infections into a trackable, standardized percentage. Step 1. You count the number of patients diagnosed with a specific condition in a given hospital. Step 2. You divide that by the total number of patients admitted to that same hospital over the reporting period. And Step 3, you just multiply by 100 to generate a clean percentage incidence rate. Doing it this way standardizes the math, allowing a tiny rural clinic and a massive urban research hospital to be evaluated on the exact same scale. Pretty smart, right?
Next up, Section 4, Tracking Unplanned Readmissions.
So, the crucial point is, we've looked at sudden errors, and we've looked at conditions acquired during the stay. But what happens after a patient actually leaves the facility and goes home? 30 days. That is the magic number. This is the strict, standardized window that defines a hospital readmission. If a patient is discharged and ends up back in the same hospital, or honestly, even a completely different hospital, within 30 days, a timer goes off, and the system immediately flags it.
Now, we absolutely have to make a critical distinction here. Hospitals track both total readmissions and unplanned readmissions. Total readmissions just include any return to the hospital for any reason within that 30-day window. But unplanned readmissions, that's the real metric of concern. This is a return that was unscheduled and unanticipated. Contrasting the two highlights the crucial difference between, say, a patient coming back for a totally scheduled follow-up surgery versus a complete failure in the initial care strategy that forced that same patient to rush back to the emergency room.
So why exactly do these unplanned readmissions happen? Honestly, it's usually a sign of systemic failures. Patients are forced to return unexpectedly due to an unresolved acute illness, which basically means the hospital sent them home before they were actually cured. It can also be due to poor management of a chronic illness, the sudden development of brand new medical complications related to their first stay, or major gaps in outpatient care, meaning they just weren't given the right instructions, medications, or support when they were discharged. A high unplanned readmission rate is a massive red flag.
And finally, Section 5, Why these metrics matter.
We've gone pretty deep into the weeds today on the data of serious reportable events, hospital-acquired conditions, and unplanned readmissions. But tying all these data pillars back to the larger business impacts, the SASB source material actually sums it up perfectly with this quote: "Quality care delivery and patient satisfaction are essential value drivers for healthcare delivery entities. Preventing surgical errors, fighting off ward infections, and ensuring a patient is actually healthy enough to go home without bouncing right back isn't just a moral duty. From an organizational perspective, it is absolutely fundamental to protecting brand value and achieving financial success. Poor metrics mean nasty lawsuits, a total loss of community trust, and massive financial penalties."
Which leaves us with a pretty profound thought to chew on as we wrap up. When you finally pull back the curtain and look at a hospital's hidden scoreboard, when you're staring at the raw data of preventable errors, acquired infections, and readmission rates, are you seeing a pure place of healing, or are you actually looking at a complex industrial system of managed risks? It certainly changes the way you look at the healthcare industry for sure. Thanks so much for joining me on this deep dive, and keep asking the hard questions.